quiet.
All right, we're quiet.
Entirely. I've had a few king-size anxiety attacks, which have been really distressing.
Really?
And I think some of it is connected to my emotional feelings, to the excellent Dr. what's his name?
General Patton.
Dr. General.
Yeah.
Yeah. And in my heart and in my soul, I need to solve that some way. And it's not going to be with him.
Okay. Okay.
I'm sure he is world class, but he's not for me.
Right. Okay.
He's for someone else.
We can arrange a different radiation oncologist.
I would really, really appreciate it, because what I would like to do is take this wonderful man and have him be someplace else.
Okay.
And there's nothing wrong with him, but it's not my match.
We'll set that up.
Thank you. And now we can forget him.
Okay. So things are better with the steroid, the
Oh my
Decadron?
gosh, it is night and day.
It is a
Okay. So I would stay on the twice a day for now, and once we get started with the radiation, we can gradually cut back on it. But sometimes that can cause a little, I don't know, as far as agitation or just feeling kind of edgy.
Oh, really?
We have to,
Okay.
I think part of it was we just didn't recognize that that was the
We didn't know what the problem was.
But you could use the clonazepam, Klonopin, that's what you
Xanax?
have? Or Xanax, I'm sorry, the alprazolam. You
Right,
can
exactly.
use that if you need.
And we have been doing that.
Yeah, that's okay.
And I was trying to hide this from my family because I didn't want them to distress them.
Don't do
And that's
that.
a mistake.
Yeah, no, that's...
What we have found was after the, you know, when we had the issue with the steroids and causing the anxiety, we started upping the dosages of the
Anxiety pills.
anxiety pills, and that actually turned out to be too much, because then what we were doing is masking that and putting a big cloud over it.
Yes.
And that
Well,
That was bad.
hopefully we can get things started with the radiation. We'll set it up to see someone else, and hopefully
Get in there
you know, the
quickly.
next week that can get started, and then we can start cutting back on
When
the
you say
steroids.
next week, what day are you talking
Well,
about?
we'll call. We'll see
What can
potentially
you arrange?
tomorrow or the next day. You could get set up to see someone, and they could start the treatment shortly thereafter.
Okay,
Wonderful.
one more thing that's added to this little puzzle is Marty set up the ascorbic acid treatment. And that'll be starting on Monday.
Okay.
How do you feel about that?
Well, I guess I don't. As far as the data, I haven't seen any data. You know, as far as verifying a documented benefit. But I think the problem with this particular tumor type is that I think the radiation hopefully will be beneficial. Doing chemotherapy, kind of the conventional chemotherapy in people over 65 or 70, the track record of that, I would say, is iffy.
Right.
And there are people who, if you're quite up and around and totally functional, that there are a small fraction of people who do benefit from this drug called Temodar, given in combination with the radiation.
Temodar is the chemotherapy, right?
That's kind of the conventional chemotherapy drug.
Okay.
How that would react with the vitamin C, I would say, is you may not do as well with Temodar. Actually, there are some potential that it could potentiate it and make the effect stronger, so it makes me a little more hesitant to do Temodar if you're going to do the vitamin C. Although I think to do Temodar, which is for someone who is 40 or 50, that would be the standard approach, and someone who's 70, it's a little more iffy, although it would not be completely unreasonable to try it. But I think with the vitamin C issue, it makes me a little uncomfortable with doing it, and I think just doing the radiation, and then we can kind of see how things go.
Would you like to wait and see until Marty is here and could discuss this with you?
He'll be back on April 7th.
Okay. Well, yeah, we can. Well,
you would like to do that,
I think what we should do, we need to set it up for you to see a different radiation oncologist, which hopefully will be in the next day or two. And then, so he'll be back on the 7th.
7th, that's the Thursday.
No, maybe
about another week.
He's up to, we could meet maybe on the 8th or the 11th.
We'll set that up. We'll set up.
Okay.
And then we can kind of review if we should, how we should
We
do
want
it.
you to be comfortable professionally.
Well, you know, I think to me, I want you to have the best possible treatment for this, which is, it's not a black and white
No,
thing.
it isn't.
No, that's clear.
Marty was thinking that, now see, I'm not a medical person, so I don't know this at all, but he was saying that the vitamin C treatment would actually improve the results of the radiation and chemotherapy.
Well, and ideally, we would do that with the hyperthermic treatment
might,
too.
yeah.
Maybe it was the hypothermic treatment
I
that
would
had
say
their...
it's not,
But it's not clear.
I don't think we can say definitively about that.
Right.
Have you read about this, the ascorbic acid?
Well, there's a lot of,
So you have read
you know,
about
people
it, but
have
you don't...
published it, but there aren't really, you know, like for
Numbers, huh?
conventional chemotherapy, there are, you
I
know,
understand.
large trials of people who are treated versus not, and kind of more,
And it's an individual thing too.
right. So,
Yeah.
but I think, you know, I think it's certainly not, I don't think it's unreasonable
We are
to do it.
so grateful that you are opening your mind to these possibilities. And if it's better for us to wait until Monmouth comes back.
No, well, no, I think I think that's fine, and then we'll meet maybe that Monday after, like,
Yeah.
I think that's the 11th.
That's the 8th, or the 11th, do you not have an appointment on the 8th?
Well, I was thinking if he's just getting back on the 7th, I'm sure he wants to.
He might. This is very, very
It's up to-
important. I mean, of course, he's going to have a little jet lag to to deal with.
Well,
but-
either which one would you prefer?
Are you open both days?
Yeah.
What do you have late on the 8th?
Well, I'm sure we have either
In the
either
afternoon,
day.
maybe.
If you prefer the 8th, we can do that.
I think we could do.
Like late in the afternoon, so he has a good night's sleep or
Okay.
whatever. And
Yeah,
everything.
Gather
just
himself
tell
up.
the scheduler about
Okay.
that. And then we'll set it up.
Have you read or seen many studies on the hyperthermic treatments?
Well, not so much with brain.
That's
I
what-
mean, there are lots of things with other,
Yeah, like
especially
a
in the
surface
esophagus and that, but I'm not aware of anything
In the brain.
in glioblastoma doing that.
Yeah, I've read a little bit about that, and it's tough to do that because you basically have to heat up the entire organ, which is tough.
Yes, I think, I'm not sure what the technique of
I
that
don't know.
even
I don't know
is.
either. I just know that there aren't a whole lot of choices.
Well, I mean,
Laying on the line.
I think that is true, but I think to me, you know, I think if
There are
there's
some
something we
choices.
can, like the Temodar, the reason to do it is that there are a small fraction of patients who do seem to have a good response to it, but it's
What kind of percentage
well,
are you talking about?
you know, as far as just surviving even 12 or 18 months, there are a small fraction of patients who, with Temodar and radiation, can achieve that.
Is that a quality?
Well, yeah, if in that small group. On the other hand, there are risks of the Temodar in terms of lowering blood counts and that kind of thing, and in aggregate, overall, for people who are over age 65 or 70, the effect of adding Temodar, I would say, is not clearly beneficial. There are,
What are the risks, or what do you would be the typical negative side
well,
effects
the
or
main
risks of
things would be
Temodar?
the risk for, you could have nausea with it. It could cause the blood counts to be low, and you could be at risk for infection.
So you'd be watching for that.
So those would be the
Now,
biggest things.
what about blood clots? Because I know we talked about, Dr. Molly about the.
Well,